Minutes, time starts now.
Okay. Good evening, everyone. I'm Dr. Sanskriti presenting on topic clinical trends in ROP and its management. ROP is one of the most common preventable ocular disease in premature, if not treated, leading to blindness. With increased number of SNCU, there is an increased number of preterm neonates, resulting in increased incidence of ROP. Therefore, appropriate screening and timely treatment are important. The aim of our study was to determine the incidence, risk factor, and treatment outcome of ROP and institute, which is SMC REVA. The study was done around September 2022 to April 2023, and the sample size was around 623, and the study design was a cohort study. The study participants were around all infants with birth weight less than 2 kg and the gestational age around 36 weeks. Baby with higher birth rate or gestational age if advised by their neonatologist. ICROP3 was used for classification and standard guidelines were used for its management. Incidence, risk factor, and treatment response were noted. In our study, in 623 infants, ROP was diagnosed in only 51 infants, in which type 1 was around 34. In 34 babies, in which in 29 we gave anti-VHF, 80 have regress ROP, and 11 needed further laser. In 5 babies, we have given laser, which has regress ROP. The overall incidence of our ROP was around 8%, but in preterm, the incidence of ROP was more, around 13%. The mean gestational age for ROPs we were 32 weeks, and mean birth weight was around 1.4 kg. In my study, we found out the AROP frequency was more, which was around 25 babies diagnosed with AROP, followed by stage 1, followed by stage 2 and stage 3, and followed by stage 4. There was no baby with stage 5 ROP. In AROP, zone 1 was more common than zone 2. RDS, exposure to oxygen, and multiple gestation, low birth weight were found to be a significant risk factor associated with ROP. When we compared our study with different studies published in India, the incidence was less compared to other studies, but the mean gestational birth weight was similar. Low birth weight and number of days of oxygen and RDS gestational was significant risk factor, which was similar to the study published by Kumar et al. In our study, zone 1 AROP was most common than zone 2, whereas in different study in India reported zone 2 be more common. Tekchandani et al. Reported 15.6% babies with stage 4 and 5 ROP, when our institute, the incidence of stage 4 ROP was much lesser, which was around 3.94%, and no baby was detected with stage 5 ROP, suggesting a better screening protocol in our institute. Conclusion, in my study, the incidence of ROP was 8% and preterm was 13. RDS, exposure to oxygen, multiple gestational, and low birth weight was significant risk factor. There was a high incidence of AROP, and anti-VEGF was most common treatment modality used.
Okay. Kind of.
This was, thank you very much. So this study was conducted in one institute or?
Only one institute.
In one institute.
Yes,
Okay.
ma'am, only one institute. We got referred in our locality region. Our institute is only tertiary healthcare center, so we get referral cases also from district hospital and other hospitals.
Okay. So what was the outcome of the treatment?
Ma'am, in treatment outcome, all babies fortunately have regressed ROP and mature retina. In last, there was no baby with stage 5 of ROP. And after anti-VEGF, even we don't even have a complication like RD or something like that during our study period.
Okay. Thank you.
Thank you.